Hey everyone, welcome to a deep dive into, well, kind of a pain in the body rheumatology. We're diving into this medical school lecture you sent in because it seems you're ready to tackle aches, pains, all that fun stuff. But don't worry, we're not going full-on doctor speak here.
Yeah, this lecture is actually a great place to start, gets into the common stuff most people see.
Exactly. I mean, who hasn't twisted an ankle, heard a pop, and gone, wait, is that a sprain or a strain?
Huh?
Luckily, this lecture lays it all out. Sprains, it's all about those ligaments, holding those bones together.
And strains, those are your muscles and tendons basically yelling at you.
Right. And then there's avulsion, which honestly sounds kind of terrifying.
Like something ripped right out, which,
Yeah.
well,
Yeah, ouch. Tendon or ligament straight off the bone.
exactly. And it reminds you, like, our bodies are tough, but this lecture makes it clear, even a simple muscle tear, those cells take time, like up to 6 weeks to regenerate.
6 weeks. Wow. Okay, healing takes time.
It does, and that's why knowing that is, like, huge for anyone getting over an injury, right?
Definitely. Makes you appreciate that whole crime thing even more.
Yeah.
Compression, rest, ice, motion, elevation. I don't know why, but I always remember that one.
It sticks with you. And it really highlights how important those first steps are for inflammation. It's like your body sends out that SOS signal, inflammation's the first responder on the scene.
Okay, I like that analogy. So we've got sudden injuries down, but what about those like nagging pains, like the lecture gets into tendonitis?
Which, that's your tendon getting irritated, inflamed, all that fun stuff.
Right, and then there's this whole other thing, epicondylitis. Sounds way more intense.
It's true. It's like tendonitis is a bigger, stronger, more stubborn relative. Still inflammation, but usually more targeted, more uh, intense, I guess you could say. I think tennis elbow, golfer's elbow, those classic examples they use in the lecture.
Right, which honestly, even if you're not an athlete, those sound familiar.
Oh, for sure.
And speaking of, this lecture also mentions Osgood-Schlatter disease. Something about young athletes, right?
Yeah, interesting. It highlights how vulnerable growth plates are, Osgood-Schlatter, specifically where that tendon attaches below the kneecap, overuse, bam, pain and inflammation.
So basically, young athletes, or rather their parents, listen up. Rest is important.
It really is. It's
Yeah.
about working with your body, not against it, right?
Totally. Now, while we're on the topic of joints, let's talk about when things go a bit, well, out of place. Because this lecture gets into dislocation versus subluxation, and honestly, I always thought those were basically the same. Subluxation's just like elite version or something.
Easy to think that, but the lecture, it makes a clear distinction, right? Dislocation, that bone's completely out of its socket, which, yeah, not ideal. Subluxation's more like a partial slip. Still not good, obviously, needs attention, but different level of severity.
Yeah, that makes sense. And this lecture really stresses, like, dislocations, those are serious. Mentions blood vessels, nerves, all that scary stuff.
Well, yeah, when those bones are where they shouldn't be.
Right, exactly. Okay, so dislocations, urgent care, got it. But then there's bursitis. Right. Which the lecture reminded me about bursae, those little fluid sacs, right?
Your body's built in padding.
Exactly. But when those get inflamed,
Not fun. And this lecture really points to like overuse, repetitive motions, that kind of thing. The examples they use are really helpful, actually. Like a pitcher, their shoulder, golfer's elbow, obviously.
right. Or even musicians, their hands, I'd imagine.
Oh, absolutely. It's all about that repetitive stress.
Too much of a good thing, huh?
Ah.
Which, speaking of, brings us to a big one, carpal tunnel.
Yeah, and the lecture does a good job, I think, of breaking it down simply. It's all about that median nerve in your wrist getting all, like, pinched.
Sharing space with all those tendons and whatnot.
Yeah, and those repetitive motions, typing all day, using a mouse, that just makes it worse.
Oh, and don't even get me started on how most of us sleep. Curled up, wrists bent.
The worst. Putting pressure right on that nerve. The lecture even mentions those tests, the Tinals and Phelan's. Might ring a bell.
Oh, yeah. Just a few movements, but wow, they really tell you what's going on.
They do. And the good news is there are ways to manage it. Splints, stretching, that kind of thing.
Prevention is key.
Yeah.
But we've talked a lot about joints. This deep dive wouldn't be complete without bones, right?
Right.
And this is where the lecture got really interesting for me because it explains how our bones are constantly, like, rebuilding themselves. Osteoclasts and osteoblasts, they're called.
It's a demolition and construction site in there. The osteoclasts break down the old bone, and the osteoblasts come in and build up the new bone.
Exactly. And get this, they're influenced by these signaling molecules.
Yeah.
Rank-Etel, rank, and OPG.
Ah.
I know, sounds complicated.
A little bit, but basically think of them like messengers, telling the other cells what to do. It's a delicate balance, though, right? AR-NKL activates the osteoclast to break down the bone, and then OPG is like, hold up, let's protect the bone.
So it's like this constant back and forth, breaking down and building up.
Exactly. And the lecture even highlights how hormones can get involved in all of this. Estrogen, androgens, those can impact bone health as well.
Which, I mean, that makes sense, right?
Yeah,
Like women after menopause, estrogen levels drop, often see bone loss.
exactly. It's all connected.
Which brings us to, well, a condition I think a lot of people worry about as they get older, osteoporosis.
And for good reason.
Right. And the lecture defines it as basically low bone density, making bones weaker, more likely to fracture.
And it even gets into how it's diagnosed, talking about DXA scans.
Those are the scans that measure bone density, right? I've heard of them.
Exactly.
But what do those scores actually mean?
It can be a little confusing, so the lecture breaks it down. There's the T-score, which compares your bone density to a healthy young adult, basically the baseline. And then there's the Z-score, which compares your bone density to other people in your age group and demographic.
Okay, so it's more personalized.
Exactly. And the T-score, a score of -2.5 or lower, usually indicates osteoporosis.
So the lower the score, the weaker the
Well,
bones.
exactly.
Okay, that makes sense. So takeaways here, folks. Pay attention to your bone health. Talk to your doctor about DXA scans if you're concerned. Get enough calcium, vitamin D, all that good stuff.
Can't forget weight-bearing exercise. That's crucial for building and maintaining strong bones.
Right, of course. Now, the lecture doesn't just stop at osteoporosis. It also touches on some other conditions, like osteomalacia and rickets.
Which are both related to vitamin D deficiency.
Ah, okay. So getting enough sunshine really is important.
It really is. It helps your body produce vitamin D, which is essential for bone health.
See, it all comes back to vitamin D.
Yeah.
But really, it's fascinating how something as simple as a vitamin deficiency can have such a big impact on your bones.
Absolutely. This lecture really highlights how interconnected everything is in our bodies.
It does. And speaking of interconnectedness, the lecture takes an interesting turn, diving into conditions that involve both the musculoskeletal system and infection. Like, first up, we've got osteomyelitis. And I'll be honest, even saying it's a mouthful, let alone,
Sure.
having it,
Yeah, it's not pretty. The lecture calls it out a serious bone infection. And the usual suspect, Staphylococcus aureus.
oh, I've heard of that one. Not good.
Not good at all. Especially if it gets deep into the bone, treatment's a real challenge.
See, that's what makes this lecture so fascinating, but also, like, kind of scary.
Mm-hmm.
Because it mentions things like drug use, animal bites. Those can increase the risk of osteomyelitis, like on top of everything else, right?
It's about being aware of the risks. Like those situations, they can introduce bacteria, make infection more likely. But the good news is the lecture does talk about treatments, antibiotics, sometimes long courses, and in some cases, even surgery to clear out that infection.
So yeah, definitely catch it early if you can. Okay, moving on to something maybe a little less intense. The lecture wraps up with gout, another type of arthritis, but this time it's all about, like, uric acid crystals.
Right, exactly. And the lecture really gets across how much gout hurts. It describes it as this buildup of uric acid crystals, usually in the big toe, causing all this inflammation. And it's not just a dull ache. We're talking like intense, sudden, often excruciating pain.
The lecture didn't hold back. Have you ever actually, spoken to someone going through a gout attack?
I have. And let's just say it's not something you want to experience. If you've had it, you know.
Wow. Okay, so how does someone avoid ending up with a gout flare-up?
Well, the lecture gives some pretty practical advice, especially when it comes to diet. Apparently, foods high in these things called purines, red meat, shellfish, organ meats, even some alcoholic drinks, those can make uric acid levels spike.
So there's your excuse to skip that extra steak.
Oh.
But seriously, it's wild how a deep dive into, like, rheumatology ends up with dietary advice. But hey, I'm here for it. And honestly, that's what I love about this lecture and about what we do here, going from basic sprains to, complex stuff like osteomyelitis.
Exactly. If there's one big takeaway from all this, it's that the musculoskeletal system, it's complicated, everything's connected. What impacts one part impacts the whole thing.
Right. It makes you appreciate the human body, how it all works, and how important taking care of it is. So to everyone listening, whether you're, a hardcore athlete just starting out or just want to know your body better, hopefully this deep dive into rheumatology has been helpful.
Absolutely. Remember, the more you know about how your body works, the better choices you can make for your health.
Couldn't agree more.
Yeah.
Thanks for joining us on this adventure, I guess you could say. And until next time, stay curious and take care of yourselves.